I'm Dr. Charles Ruotolo from Total Orthopedics and Sports Medicine, and today I'm going to be talking about my philosophy on ACLs or anterior cruciate ligament tears. Your anterior cruciate ligament is a ligament that's in the center of your knee. It runs from the front of your tibia to the back of your femur and prevents the knee from moving forward like this. This is a ligament that can be commonly injured in sports. In the United States, between 100 to 150,000 patients undergo anterior cruciate ligament reconstruction per year. There's a couple different problems with an ACL. When an ACL tears, you can also have other injuries in your knee joint. You can tear your meniscus, which is the rubbery cartilage between the two bones. You can injure the cartilage itself, and you can even have fractures in your knee where you break part of the bone. Once an ACL tears, once this ligament tears, this just kind of rips into shreds and is unable to be repaired, and in that scenario your ACL needs to be reconstructed. For ACL reconstruction, there's a couple different things that you can use to replace that ACL. There is something called allograft, or a tissue that's from a cadaver that's donated that you can use to replace your ACL, and there's autograft, meaning tissue from yourself that you take from yourself to use to replace your ACL. I always like to use autograft unless it's a scenario where you have multiple ligaments in your knee where there's just too many things torn to just take from yourself to replace. The reason for this is allograft tissue has been shown to have a higher re-tear rate than autograft tissue, and for these reasons I think taking your own fresh healthy tissue is the way to go. As far as which graft, there's a lot of controversy in this, and across the United States there's certainly a variance in what people do. But the two most common grafts for this are your patella tendon graft, which is a piece of bone from your tibia, the middle third of your patella tendon, and a piece of bone from your patella, or a hamstring graft, which is a small incision on your leg here where you harvest one or two of your hamstring tendons, one of the smaller hamstring tendons on the inside part of your leg, to replace your ACL. As far as my choice, I like to use a hamstring graft, and it's for a couple different reasons. One, first of all, it's a smaller scar. The scar for your hamstring is usually about so big on your leg, where the patella tendon one is usually about this big. As far as knee pain, after you harvest the patella tendon graft, you almost always have pain when you kneel, because when you kneel down you have a piece of bone missing from here and a piece of bone missing from there, so when you kneel you can have discomfort from that. And that might not be significant to someone who's 18 and is playing soccer, but if you have any kids, you spend a couple years of your life kneeling all the time. The other thing is pain, and certainly an ACL reconstruction hurts. There are some drilling that you have to do in the bone which causes pain, but with the patella tendon graft you also have a piece of bone missing from here and a piece of bone missing from there, so it's a significant more pain than a hamstring graft immediately after surgery. And then the most compelling reason why I do a hamstring over patella tendon is there's two studies looking at these patients over a long term, and in both the studies it showed that if you use a patella tendon graft you have a higher rate of arthritis than using a hamstring graft. In one of the studies they took it was two groups of patients, one who all got patella tendons, one who all got hamstring tendons. They took out all the patients who had any other sort of injury, a meniscal injury or cartilage damage, and they looked at patients who only had ACL tears. And when they looked at them after 10 years, the patella tendon grafts had a 50% rate of osteoarthritis in their knee, and the hamstring graft only had a 21% risk. And for these reasons, I like to use a hamstring graft. The other exciting thing is the way we've done this over the years has evolved. I currently do a single tendon hamstring reconstruction, which is an all inside technique, meaning that I make a small incision here, I harvest one tendon, your semitendinosus tendon, and if that is long enough, I'll fold it into fourths, and then from there I do what's called an all inside technique, meaning looking inside the knee joint arthroscopically, so making a tiny incision here, a tiny one there, a tiny one up top. I'll put a camera inside the knee. Through this incision where I harvest it, I drive a small pin up to the footprint of the ACL on the tibia, on the leg bone, and then I have a special reamer that can ream from that, using that pin, can ream a socket partway down in the tibia I do the same thing on the femur, going from the outside to here and leaving a socket only part way up, and then I'll pull that up and fix it on both sides. The advantage of that is you're only harvesting 1 instead of 2 hamstring tendons, and then also there's a little less drilling of bone, which is thought to decrease pain after the surgery.